An abdominal aortic aneurysm is a bulging or swelling of the aorta, the largest blood vessel in the body, as it passes through the abdomen. The aorta carries blood from the heart to the rest of the body, and it is normally about the size of a garden hose. However, when an aneurysm develops, the aorta can become as large as a grapefruit or even bigger. And an abdominal aortic aneurysm can be life-threatening, as it can rupture and cause massive internal bleeding. According to the Centers for Disease Control and Prevention, about 13,000 people die each year in the United States from a ruptured and abdominal aortic aneurysm. Risk of rupture increases with the size of the aneurysm, and it is higher for men, smokers, and people over 65 years old. In this video, we will explain what causes an abdominal aortic aneurysm, what are the symptoms, how it is diagnosed, and how it is treated. I will also share some tips on how to prevent or delay the development of an abdominal aortic aneurysm, and what to do if you suspect you have one. What causes an abdominal aortic aneurysm? The exact cause of an abdominal aortic aneurysm is not fully understood, but it is believed to be a result of a combination of genetic and environmental factors. Some of the factors that can increase the risk of developing an abdominal aortic aneurysm include age. The risk of an abdominal aortic aneurysm increases with age, especially after 60 years old. Gender. Men are 4 times more likely than women to have an abdominal aortic aneurysm. Family history. Having a close relative who had an abdominal aortic aneurysm increases the risk by 4 times. Smoking. Smoking damages the walls of the arteries and weakens them, making them more prone to aneurysms. High blood pressure. High blood pressure puts extra stress on the aorta and can cause it to stretch and weaken. High cholesterol. High cholesterol can lead to atherosclerosis, a condition where fatty deposits build up inside the arteries and narrow them, reducing the blood flow and increasing the pressure. Other diseases. Some diseases that affect the connective tissue, such as Marfan syndrome, Ehlers-Danlos syndrome, or Loeys-Dietz syndrome, can make the aorta more fragile and susceptible to aneurysms. Inflammation. Some infections or inflammatory diseases, such as syphilis, tuberculosis, or vasculitis, can damage the aorta and cause aneurysms. Trauma. An injury to the abdomen, such as from a car accident or a fall, can damage the aorta and cause an aneurysm. What are the symptoms of an abdominal aortic aneurysm? Most people with an abdominal aortic aneurysm do not have any symptoms, and they may not even know they have one, until it is discovered by chance during a routine physical exam or an imaging test for another reason. However, some people may experience some signs or symptoms, such as a pulsating feeling or a throbbing pain in the abdomen, especially near the navel, back pain, lower back pain or flank pain, a feeling of fullness or pressure in the abdomen, nausea, vomiting or loss of appetite, constipation or difficulty passing stool, leg pain, numbness or weakness. If an abdominal aortic aneurysm ruptures, it can cause a sudden and severe pain in the abdomen or back, accompanied by shock, fainting, sweating, rapid heartbeat, low blood pressure, and loss of consciousness. This is a medical emergency and requires immediate attention, as it can be fatal within minutes. How is an abdominal aortic aneurysm diagnosed? The best way to diagnose an abdominal aortic aneurysm is by using an ultrasound, which is a painless and non-invasive test that uses sound waves to create images of the internal organs. An ultrasound can measure the size and shape of the aorta and detect any aneurysms. Other imaging tests, such as computed tomography scan or magnetic resonance imaging, can also be used to diagnose an abdominal aortic aneurysm, but they are more expensive and expose the patient to radiation or magnetic fields. The American Heart Association recommends that men aged 65 to 75 who have ever smoked should have a one-time screening for an abdominal aortic aneurysm with an ultrasound. Men and women who have a family history of an abdominal aortic aneurysm or other risk factors should also be screened. If an abdominal aortic aneurysm is detected, the patient should have regular follow-up ultrasounds to monitor the growth of the aneurysm and the risk of rupture. How is an abdominal aortic aneurysm treated? The treatment of an abdominal aortic aneurysm depends on the size, location, and growth rate of the aneurysm, as well as the overall health and preference of the patient. The main goals of treatment are to prevent the aneurysm from rupturing and to reduce the symptoms and complications. The two main options for treatment are watchful waiting. This involves regular monitoring of the aneurysm with ultrasounds and medication to control the blood pressure, cholesterol, and pain. This option is usually recommended for small aneurysms, less than 5.5 centimeters or 2.2 inches, that are not causing any symptoms and are growing slowly. Surgery. This involves repairing or replacing the damaged section of the aorta with a synthetic graft, which is a tube made of metal or plastic. There are two types of surgery for an abdominal aortic aneurysm. Open repair. This is the traditional and more invasive method, where the surgeon makes a large incision in the abdomen or chest, clamps the aorta, removes the aneurysm, and sews the graft in place. This procedure requires general anesthesia and a longer hospital stay and recovery time. Endovascular repair. This is a newer and less invasive method where the surgeon makes a small incision in the groin, inserts a catheter, a thin tube, into the femoral artery, and guides the graft to the aneurysm site using X-ray images. The graft is then expanded and attached to the aorta with hooks or stents. This procedure requires local anesthesia and a shorter hospital stay and recovery time. The choice of surgery depends on the size, shape, and location of the aneurysm, as well as the age, health, and preference of the patient. Both types of surgery have benefits and risks, and the patient should discuss them with the surgeon before making a decision. Surgery is usually recommended for large aneurysms, more than 5.5 centimeters or 2.2 inches, or aneurysms that are causing symptoms or growing rapidly. How to prevent or delay an abdominal aortic aneurysm. While some risk factors for an abdominal aortic aneurysm, such as age, gender, and family history, cannot be changed, there are some lifestyle changes that can help prevent or delay the development of an abdominal aortic aneurysm, such as quit smoking. Smoking is the most important and modifiable risk factor for an abdominal aortic aneurysm, and quitting can reduce the risk by half. Control blood pressure and cholesterol. High blood pressure and cholesterol can damage the walls of the arteries and increase the risk of aneurysms. Controlling them with medication, diet, and exercise can lower the risk. Eat a healthy diet. Eating a balanced diet that is low in saturated fat, salt, and sugar, and high in fruits, vegetables, whole grains, and lean protein can help prevent or delay atherosclerosis and improve the blood flow and the health of the arteries. Exercise regularly. Physical activity can help lower the blood pressure and cholesterol, strengthen the heart and the muscles, and maintain a healthy weight. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, or a combination of both. Lose weight. Being overweight or obese can increase the blood pressure and cholesterol and put extra strain on the heart and the arteries. Losing weight can help reduce the risk of aneurysms and other cardiovascular diseases. Limit alcohol. Drinking too much alcohol can raise the blood pressure and damage the liver, which can affect the cholesterol levels and the clotting factors. The American Heart Association recommends no more than 1 drink per day for women and 2 drinks per day for men. Manage stress. Stress can increase the blood pressure and the heart rate and trigger unhealthy behaviors, such as smoking, drinking, or overeating. Managing stress with relaxation techniques, hobbies, or counseling can help lower the risk of aneurysms and other health problems. What to do if you suspect you have an abdominal aortic aneurysm. If you have any of the risk factors or symptoms of an abdominal aortic aneurysm, you should see your doctor as soon as possible and ask for a screening test. If you have a confirmed abdominal aortic aneurysm, you should follow your doctor's advice on the best treatment option and the frequency of follow-up tests. You should also make the lifestyle changes mentioned above to prevent or delay the growth of the aneurysm and the risk of rupture. If you experience a sudden and severe pain in the abdomen or back, along with signs of shock, such as fainting, sweating, rapid heartbeat, low blood pressure, or loss of consciousness, you should call 911 or go to the nearest emergency room immediately, as this could be a sign of a ruptured and abdominal aortic aneurysm, which is a life-threatening condition. An abdominal aortic aneurysm is a serious and potentially fatal condition that affects millions of people worldwide. However, with proper screening, diagnosis, treatment, and prevention, it can be managed and controlled. If you have any questions or concerns about an abdominal aortic aneurysm, you should talk to your doctor or a vascular specialist who can provide you with more information and guidance. Thank you for watching.